Short presentation speaker is Dr. Justin Marchegiani, and while Dr. Justin, we'll call him Dr. Justin for short, studied at the University of Massachusetts, he started off his career working in a surgical center as he prepared for his medical school training. He was able to see where it shined, especially in the area of treating acute injuries and trauma, and also saw its shortcomings, which were most evident in the areas of chronic disease like diabetes, heart disease, and obesity, which currently plague our society today. This experience shifted Justin's focus from traditional medical approach to a natural medical approach to healing. Dr. Justin is a graduate of the University of Massachusetts at Amherst with a BS degree in kinesiology and pre-medical studies. Dr. Justin has completed his doctorate degree in chiropractic medicine from Life West University. Dr. Justin has just completed the postgraduate study in the area of clinical nutrition, exercise, and functional medicine, so he can offer the most cutting-edge techniques to help address his patients' growing health need cares. Dr. Justin works with a wide variety of patients, all the way from athletics, trying to increase performance and heal from injuries, to every person with chronic health problems. There's more on this, but let's just welcome Dr. Justin. Thank you.
All right, yeah, you got it. I got multiple microphones here, so hopefully there's no issues in hearing me here. So the goal of today's talk is to really bridge what some of the information and the science is saying, and kind of taking it to the layperson and saying, what can you do? How can you assess your thyroid? How can you become healthier? But also backing it up with some science, just so you know I'm not making it all up. So again, thyroid is one of the biggest issues plaguing our society. Hypothyroidism, autoimmune thyroid conditions. Levothyroxine, or Synthroid, is the #4 prescribed medication in the country. Yet we're seeing more and more people with hypothyroid. And a lot of these symptoms here are the underlying causes, or basically hypothyroidism is driving the majority of these symptoms. One of the things we also see here that's kind of controversial is high cholesterol. Thyroid hormone was actually used in the late 80s for even treating high cholesterol. So just because you have high cholesterol, it could also be an underlying thyroid issue. I think someone asked that question earlier. So we're going to try to address all of these things one by one here. So again, we have thyroid imbalances in the middle, but there are many things that drive thyroid imbalances. Female hormone issues, we're going to touch upon each one of these in the slides. Toxins, infections, adrenal and blood sugar issues, so when you eat, how often you eat, what type of macronutrients you're eating, gastrointestinal problems, and the immune system. So again, a little recap for anyone that's not familiar with thyroid physiology. We have our pituitary, which produces a hormone called TSH. That's the typical hormone that conventional physicians are measuring and basing your thyroid function off of. Big mistake, we'll go into why that is. TSH basically screams down to your thyroid, make some thyroid hormone. It produces a hormone called T4, which is inactive thyroid hormone, and T4 gets converted in the liver, about 60%, in the gut by healthy gut bacteria, about 20%. The other 20% can be converted based on how stressful your lifestyle is, and we'll go into how we can change that. So the first thing, let's talk about right. All right, so again, we have T4 over here. One of the biggest issues that we see in conventional medicine is the prescription Synthroid is a synthetic T4 molecule. Most people that have a thyroid issue have a decreased ability in converting T4 to T3. So typically T4 is given, we convert it to T3, there are specific enzymes involved here, and we're a happy camper, because T3 is our active thyroid hormone. But we have various stressors here, whether they're cortisol imbalances due to blood sugar or inflammation, selenium deficiency. Dr. Ames was talking about various macronutrients. Selenium affects basically the key enzyme in converting T4 to T3. Gastrointestinal problems, insulin imbalance. A lady was talking about triglycerides, and that's commonly associated with insulin resistance. Again, decreased protein, anemias, whether they're anemia of iron or anemias of B9, folate, and B12. And again, what happens when we're stressed? Our T4, instead of being converted to active T3, where it's having a metabolic effect, it's getting converted into reverse T3. And essentially, reverse T3 is like the brake on the thyroid. So we want to do things and be able to assess your thyroid function so we can get more of it to T3, active T3, and not the brake or the reverse T3. So again, how thyroid hormone works. I'm going to break it down for you. This may be a little bit too simple for some, but some might just hit just right. So we have T4. It gets converted to T3. T4, again, is inactive. T3 is active. Again, we have T3 is the baseball. Okay, that's the active hormone. The catcher's mitt is the receptor site. So essentially what happens in normal thyroid function is T4 gets converted to T3. T3 binds into the catcher's mitt. That's the receptor site. And then we have what's called a metabolic or proteomic response. And that's how the thyroid should work, just like so. Gives you an idea how the lock and key receptor thyroid hormone works here. Now, typically, one of the biggest issues we're seeing in thyroid problems is almost 90% of all thyroid issues are autoimmune in nature, meaning the immune system's actually attacking the thyroid. Now, the problem with that is conventional medicine, if you have an autoimmune thyroid, the treatment is Synthroid, Levoxyl, levothyroxine. If you don't have an autoimmune thyroid, the treatment's exactly the same. You see how specific our medicine is today? So we want to actually get to the root cause. If your immune system is destroying your thyroid gland, watch what happens. I'm going to show you. It's a little bit different. So we have T4, gets converted to what? T3, great, you guys are following me. T3 then supposed to bind into the what? Into the catcher's mitt, yeah, exactly. But the immune system, the cytokines and various interleukins are actually blocking the receptor site. So we can go give Cytomel or Nature-Throid or Armour to the cows come home, and it's not going to make too much of a difference because that thyroid hormone has to bind into that catcher's mitt or receptor site to have a proteomic or a metabolic response. So this is the problem we're seeing here. And we have to address the immune system or we're not going to get to the root. And that's kind of my goal here, is to give you guys information, science-based, so you can apply it and make yourself healthier. And as you can see, this came out in 1988. Autoimmune conditions are associated with 90% of hypothyroidism. So 90% of people are hypothyroid. And guess what? I see a lot of patients in my practice, they just come in with a TSH and they're like, my thyroid's normal. At the most, we'll see TSH and T4. We won't see any antibodies, we won't see any free fractions of hormones, we won't see any reverse T3, and we'll go over that. So this is important because 90% of these patients are there, and I had one that walked into my office today. So again, this patient walked into my office today. She was told she had normal thyroid function. You can look at the cascade. I'll let you guys tell me where the problem area is. Little key, it says abnormal high. Her antithyroglobulin antibody is off the chart. So this is basically an immune marker. It's basically saying the immune system's coming in and stabbing the thyroid gland, all right, irritating it and eating it up. So then her Kaiser doctor said, well, I think we should reassess this. Ran new test, TSH and TPO, and they said, oh, it's normal. I said, but no, it's the antithyroglobulin antibody, not the TPO here. I always run both of those, but you can see, you know, looking at my assessment compared to the, you know, Kaiser person, a little bit more thorough here, okay? What's the name of that antibody again? There's two. There's TPO antibody, thyroid peroxidase, and antithyroglobulin antibody. That's typically associated with autoimmune Hashimoto's. So again, why is thyroid autoimmune disease so prone? Great article. Essentially summarizing everything, we have genetic predisposition. Certain genes make us predisposed. We have the environmental toxins, certain nutrient deficiencies, which kind of dovetails in with what Dr. Aim talked about. And we also have the endogenous things. We have hormones in our environment, we have molecular mimicry, we have all kinds of things in the plastic and pesticides, and we'll touch upon that briefly. All right, so again, right here you can see we have different chemicals such as polybrominated diphenyl ethers, PBDEs for short. You may know these as flame retardants. They're also in soft drinks. They're also in refined vegetable products. Again, really bad. Bromine, if you look at the periodic table of elements, it's a halide, all right? So you have your iodine, which is the molecule that's supposed to be in there, but below it we also have chlorine. We also have fluoride as well. Again, for anyone that doesn't know, fluoride was used in the 1940s to treat hyperthyroidism, meaning it knocks down your thyroid. So if you have a thyroid issue, you shouldn't be drinking fluoride water. And again, the list goes on here. We're going to see it in our pesticides. We're going to see it in phthalates. Phthalates essentially are in the plastic bottles. BPA is also in plastic bottles as well. Number 7 bottle is BPA. Number 1 is phthalates. Stay away from those. And again, you see it all in women's cosmetic products. And we're going to go over a couple of different reasons why women are so prone to these autoimmune conditions, multiple times higher than men. I'm postulating, I don't have research behind me per se, but you can see women engage in using some of these hygiene products more than men. And there's a couple other hormonal and immune markers as well. Again, pesticides, you can see that lots of research on this. Organochlorines are affecting thyroid function. They also affect reproductive function as well. Okay, little EPA study here. Bad font for this projector. Anyway, EPA said 100% of people have dioxins and PBDEs. And again, these are the thyroid disrupting chemicals kind of by category. So we have the halides, right? Iodine can be good or bad, all right? That's one of those things where if you're autoimmune, I recommend staying away from iodine until the inflammation has cooled down. If not, it's like throwing gasoline on the fire. Some people it's good, some people it's bad. I'll talk about that why. Bromine, again, it was in breads for a long time, so a lot of people who use iodine, they get a nice little bromine detox from the iodine. We also have the fluoride I kind of touched upon. We have all the different chemicals in the plastics, the BPA, the PBDs, the triclosan here, which is an antibiotic in soap. Stay away from that. We also have the exogenous hormones, such as in birth control pills, also in PCOS, where we have elevated testosterone. That can also affect thyroid function. And we have estrogen dominance. And I'm going to touch upon how estrogen dominance actually affects the immune system. And then we have the food, goitrogens and cruciferous vegetables. Don't be scared. Just saute them, steam them a little bit, and the goitrogens come right down. Just if you have hyper or hypothyroidism, just don't do it as raw. Steam it, saute it, and you're pretty good to go. And eat organic as well, because the organochlorines are going to be in conventional produce. All right, again, blood sugar is really important. If you have an autoimmune thyroid, and if you're a gambling person, that means you're part of the 90%. I have an autoimmune thyroid as well, so I practice what I preach. Again, inflammation is the key underlying issue for any health condition, and guess what? The thyroid is not alone when it comes to that one. So we have our blood sugar zone here, right? I call this our thyroid zone. So when we're eating refined carbohydrate, refined junk, and we're essentially a sugar burner, our blood sugar does this little roller coaster throughout the day. At the top of the roller coaster, we're making a whole bunch of insulin. At the bottom, a whole bunch of cortisol. This is the vicious cycle of storing fat, burning muscle, storing fat, burning muscle, and we become sarcopenic, essentially fatter and flabbier. Not a great combination. And again, research is also showing you're increasing cytokines, this cytokine called IL-6. So you're actually burning up your thyroid even more when your blood sugar does these dips. So the take-home message, eat every 3 to 5 hours, high-quality protein and fat, and carbohydrate mainly from vegetables. So again, eating every 3 to 5 hours, your blood sugar does this. You stay in that thyroid zone, inflammation's modulated and dampened, and you're not burning through your thyroid as fast. All right, this is really, really crucial information. I'm treating a lot of patients, and I'm finding a lot of different viral infections that the literature is supporting are associated with these thyroid issues. And you can see the biggest one that I'm seeing is Epstein-Barr, otherwise known as mono, or the kissing disease, if you will. And you can see when you look at thyroiditis right there, 4 down, you see 2 stars. So there's a really, really big association there. And we're going to talk about that right now and how that correlates with autoimmunity. So this is the woman's cycle, right? First half of the cycle, we make a whole bunch of estrogen. Second half, we make a whole bunch of progesterone. So what typically happens when we're stressed or eating bad, the progesterone in the second half of the cycle actually falls out. You see how that drops? It's one of the main causes of infertility, but the question I have is, where's the progesterone going? Well, progesterone's going down this pathway for cortisol, because cortisol is dealing with stress, it's dealing with blood sugar irritabilities, and one of the biggest things our endocrine system is trying to deal with is the onslaught on blood sugar stability. So again, as progesterone starts dropping, we go into this phase called estrogen dominance, okay? So typically we have progesterone and estrogen ratio. Progesterone is about 25 times higher throughout the monthly cycle than estrogen. Not quite drawing a scale there, but as you can see, when that cortisol gets converted from the progesterone, so the progesterone drops, watch what happens to our ratio. Estrogen starts creeping back up and we go into this state of estrogen dominance. And what that's doing is this. It's actually modulating our immune system. So Dr. Ames touched upon that. We have this CD8-CD4 ratio. Typically we want to be balanced. And what we see is when we have this estrogen dominance, this is why thyroid issues are 5 times more common in women, is we start to see a ratio of CD4 becomes greater than CD8. So our cytotoxic T cells, the ones that are guarding the entries and attacking at first sight of an enemy, become smaller. And we see a ratio of 3 to 1, 4 to 1, 5 to 1 if we want to run a blood test testing those molecules. And again, what this is doing is a great study out of University of, I think it's in Australia, Dr. Pender. What he found was the deficiency in the CD8 T cell, essentially predisposed by the estrogen dominance, the low vitamin D, and the EBV, the Epstein-Barr virus, essentially was creating a B cell infiltration, meaning different immune cells were coming into the glands of various tissue and destroying it. So this is what he found. He created the steps to autoimmunity. So essentially CD8, right, drops. That means the ability for our immune system, the Navy, the Army, the Air Force to attack the invader goes way down. So people can enter our body or our country and wreak havoc on different parts of it, whether it be organs or different tissues. And the interesting thing is even vitamin D doesn't help because these viruses actually deform the receptor site. So vitamin D can't even go in there and actually help out because vitamin D would help bring that T8, that CD8 back up, but it's not able to. And we'll talk about strategies how to actually fix that. So essentially our adrenals and our thyroid talk to each other, all right? We have the HPA axis and the HPT axis. Brain talking to pituitary, talking to adrenals, brain talking to pituitary, talking to thyroid. And I'm going to make it really simple. This is so confusing. I get it. My goal is to really streamline everything here. Again, we have the brain. We have various feedback loops. So brain talking to adrenals here, brain talking to thyroid. Think of those axes as thermostats, right? If it gets really hot in here like it is now, the AC should be on. If it gets too cold in here, the heat should come up. That's like these feedback loops. So essentially we have our adrenals that make sex hormones and cortisol. We have our thyroid that makes T4 and gets converted to what? T3, great. And again, we have cortisol, which is an important mediator or hormone in thyroid conversion. So essentially what happens, we have stress. When that stress is activated, it could be the blood sugar stuff I talked about. It could be infections. It could be chemicals. It could be emotional stress. It could be sleep. That stress becomes activated, and these feedback loops, or the thermostat, become broken. And the brain has a difficult time talking to these organs. And what you're going to see is less sex hormones, right? And we're going to see more cortisol, and we start seeing more reverse T3. That's kind of the key intermediary. So our goal is to figure out where those stressors are coming from, right? Fixing the diet, stabilizing blood sugar, addressing the infections, getting away from the toxins, and we can remove those feedback blockers. That's kind of the underlying goal here. So again, typically when we go into a catabolic state, we have all these good anti-aging hormones that help rebuild us, right? We're in this constant state of building up and breaking down. So when we have excess stress from those various things I talked about, we have more cortisol, more of these hormones that are catabolic, they're breaking us down. So our goal is to figure out where those stressors are coming from, pull away the stressors, and then we can be building up more efficiently than breaking down. That's a key concept. All right, this is a really good thing here. I mean, no one should be eating grains in here, in my opinion. One, they're nutrient poor, they're inflammatory, and they're very toxic, and they're one of the most stimulating compounds on the immune system, according to a gastroenterologist at University of Maryland. So again, what we're finding is creating inflammation in the guts creates this vicious cycle known as leaky gut syndrome. And they're finding a strong association with gluten sensitivity. I'm not going to say celiac per se, but gluten sensitivity with these autoimmune conditions. And when we know that 90% of thyroid issues are autoimmune, we have to look at the strongest stimulators according to research. So what's actually happening is this. Let's go over that. We have all these different stressors above. We have the gastrointestinal barrier here. So this is a great analogy I use. Put your hands together like this. These are the tight junction cells in your gut, All right? When inflammation occurs, whether due to infections or gluten or inflammatory foods, the gut lining comes apart a little bit, and undigested food particles can actually get through that gut lining, get into the bloodstream, where the immune system sees it, and then there's a case of mistaken identity or molecular mimicry. Essentially, the cops see a Honda Civic, they call in an APB, and then the cops pull over the next Honda Civic that it wasn't the original Civic, right? Same thing. We see gluten proteins, we see casein proteins. The immune system tags it. It sees other organ tissue like the pancreas or the thyroid with similar surface proteins. Case of mistaken identity, creating inflammation and this whole entire cascade. So again, what's happening? We have stress. That stress can be blood sugar, emotional, sleep issues, toxin issues. This breaks down our immune barrier in our gut called IgA. This is an antibody that's designed to attack things that come in that shouldn't be there. Again, food allergens, infections and toxicity, nutrient malabsorptions, and then we see the weakened immune system, and this is the vicious cycle that we see with every single autoimmune patient. And so essentially, this is kind of the gut right here. This is the whole cycle. This was our nice, healthy, tight junction. And being exposed to these chemicals, our tight junction is going into that. Again, one more time, so you can see that's healthy, and that's not. And what the research is showing is inflammation or fire in the gut equals fire in the brain. So that leaky gut now translates to a leaky brain where we're having cytokines and inflammatory molecules go out of the blood-brain barrier, crossing into the brain and igniting off these cells called microglial cells. All right, these are immune cells in the brain, and once they turn on, they don't turn off. So they're just causing all these pop, pop, pop inflammations and destroying neurons. Not a good thing. All right, so now let's go into thyroid treatments and kind of talk about what's conventional, what's natural, and the pros and cons of each. So we have T4. T4 on one side, that's natural T4 right here, tetraiodothyronine. And then we have the synthetic T4 on the right, known as Synthroid, Levoxyl, or levothyroxine. You can see, you don't have to be an organic chemist, but you can see a little bit of a difference here with the Na molecule on the end. Anyway, it's different because it can be patented. We can't patent these natural molecules here. We can patent synthetic ones. That's why T4 is owned by Abbott. All right? Then we have T4 gets converted to T3, tri-3-iodothyronine. So the tri comes from the 3 iodine molecules. Tetra, meaning 4, comes from the 4 iodine. And again, this is the different molecule. So I'm more of a natural guy, so my bias is towards the more natural, biologically appropriate hormone versus the synthetic hormone. And again, with a natural glandular, right, you're also going to be getting T2, T1, and calcitonin. Calcitonin is really important at regulating calcium balance as well. So you're getting about 4 or 5 different hormones versus the one that you may get in a conventional thyroid medication. So let's review the options here. All right, we have Abbott's pharmaceutical Synthroid. It's got cornstarch in it. It's got a couple of different food additives that aren't too good and inflammatory. We have Cytomel made by King Pharmaceuticals. That's synthetic T3. So some doctors will give Synthroid and Cytomel. I don't recommend it. There's additives, there's fillers, and again, it's not biologically appropriate. And if you're autoimmune, you're still not fixing the problem. More natural approach, you have some Armour. Armour's now has dextrose in it. It's got some corn sugar. They reformulated it in 2009. Some people aren't responding the way maybe they used to. They find chewing it now actually helps because of the higher fiber content. Urfa, that's basically Nature-Throid for Canada. That's a natural glandular for Canada as well. That's a better one. My bias is towards Nature-Throid. It's gluten-free. It's got a lot of the additives cut out, pretty hypoallergenic. And you got T4, T3, T2, T1, and the calcitonin. So you could go with Nature-Throid or Armour. I like Nature-Throid. That's my bias. There's a couple other glandulars I'll use as well. So again, really simple. If you're on Synthroid and you want to get it converted, just go to your doctor and say, hey, I want to try this natural stuff. Just make sure you realize that you should be addressing the blood sugar and the infections and the autoimmunity. Because if you just get it changed over from a more natural brand, again, you're still not fixing the root problem, right? So again, you can say, hey, this is my dose over here. Let's get it converted over here to an Armour or a Thyroid, a Nature-Throid. The biggest thing I see with doctors is they tell you, well, it's not stable. The dosages are funky. Again, this is USP here. So what USP means, United States of Pharmacopoeia, it's held to the same standards as any drug is. So it's exactly what it says, all right? So that's kind of the big thing I get a lot. So we just get it converted to a Nature-Throid, and we do a couple things to fine-tune the dose. And that's the key here. We'll talk about that, I think, next. All right. This is what your lab tests. This is why your lab tests are normal, but you feel sick, right? 95% of the population fit in that standard deviation of what's considered normal. And you know, just looking out there, 95% of people aren't healthy or what I consider normal, right? A small percentage. So in functional medicine, we're taking that range and we're narrowing it down, and we're looking at it through a lens of good, better, best. You know, are you healthy? Can you be healthier, even better? So that's kind of how we're looking at it. That's the spectrum. That's the filter. And again, right here, I can't really read that too well. What that says is that TSH is a terrible marker for looking at thyroid function. And typically, TSH is a pituitary. It's a brain hormone. Looking at brain hormone and looking at thyroid function, we're kind of extrapolating a little bit here. We should be looking at the actual thyroid hormones. We should look at TSH, but we should look at the whole beautiful cascade that comes from that, not just from the brain. All right? And we'll talk about how that looks. So again, lab test. This is a lab test from my wife here. You can see she's got her TSH up here. We look at T4 total and T4 free. The free really is what matters the most, because that's what has the ability to bind into that catcher's mitt. T4 gets converted into T3. We have total and free. And then we also have our reverse T3, and we also have our antibody. So you can see, we see she's not autoimmune. That's important, because if we just give her a whole bunch of thyroid medication, even if it's natural, it's not going to have a great effect. But you can see here, when you look at it in the functional range, her free T3 is getting close to the low end of it. So we're going to have to support her free T3 a little bit so she can have a higher metabolic response. I like being in that top 75% of the functional range. We want to have a high metabolism, the ability to create energy. Thyroid health is really important. Thyroid receptors are all throughout the body, in the brain, on every single cholesterol molecule. So we want good thyroid function. So again, I like my T3 and my T4 at the top 75% of the range. All right? And as you can see here, we also have functional ranges. So we have the big lab range. We've narrowed things down and made it a little more simple. And the key ratio that I'm a huge fan of, the research is really supporting, is this T3 to reverse T3 ratio and this free T3 to reverse T3 ratio. That's a great indicator of overall thyroid health. And I have a nice calculator on my blog page where you can actually calculate that yourself. So you can see there's a lot of different cascades that just looking at TSH or T4, you totally miss the whole boat on here. And again, the next thing is, okay, great, we have some lab tests. You know, running labs every month is kind of expensive, it's kind of annoying. So we can also look at temperature, right? Thyroid affects your temperature. What I do is I'll use this chart. Axillary temperature, 97.8 to 98.2 in the morning is ideal. All right, oral temperature, 98.2 to 98.6. So we stick a thermometer in your armpit. I recommend a specific kind of thermometer, Dr. Wilson's brand, but you put it in your armpit here, let it sit for 10 minutes against your skin, and then you can find out where your temperature is. What you're going to see, if your temperature goes up and down like these big spikes right here, that's a sign of adrenal stress. All right, so you see that right there. That's adrenal stress. So as you can see, if it's low, if it's below that 97.8 right there, that's low thyroid. If it's up and down like these peaks and valleys, that's adrenal. So if you see adrenal and thyroid stress, you can see it right on a temperature chart. As the patient gets higher here, the thyroid's starting to evening out. You can see the in-laws come in, what happens? Adrenals get stressed. You can see right here, exposure to gluten or grains, right? Adrenals get stressed. So it's a nice little indication of how your body's doing from a thyroid perspective, from an adrenal perspective, and you can do it every day and it doesn't cost you anything to do it. So we kind of gave you guys a lot of information. Action items: eat organic food, stay away from pesticides and chemicals. You should all make sure you're checked for different infections, reactivated mono, different parasite infections. Everyone should be infection-free. That's my main goal here. Eat every 3 to 5 hours if you have fatigued adrenals and thyroid. Good fat and good protein, coconut oil, grass-fed meat, all that's super important. Be a fat burner. It's way less stressful on your body, on your pancreas, on your thyroid, on your adrenals if you're burning fat for fuel throughout the day versus sugar. Where's your stress coming from? Get some functional tests. Look at your thyroid, the whole cascade. Look at your adrenals. Get a good blood panel to assess things. Again, you're only one decision away from getting healthier. This is a super, it gets really confusing with all the different factors that come in. Feel free, I do this for a living. This is my main thing. I'm really specialized in thyroid because I had thyroid issues myself. If you want me to look at your thyroid test, feel free, go to my site. You can always schedule an appointment with me via the phone or in person. We can take a look at it and kind of map out some strategies on where the next step for you may be. And I hope everyone found this information applicable, resourceful, but also you can actually use it right now. Thank you. Appreciate it.
We'll do 2 questions and fast answers, though.
Sure. Just in Health. I have cards up here too if anyone needs cards. Grab them.
justinhealth.com. JUSTIN.
Yes, sir.
You know, I like the way you started out by saying or explaining why the TSH test is no good because it's a problem with receptors.
Exactly.
So the levels of thyroid hormone, or T3, don't solve the problem necessarily, although sometimes they can overcome it, some of the receptor problems. But then you gave us, like, I think 3 or maybe 4 different ways in which the receptors could become dysfunctional.
Right.
One was the autoimmune, which I think is linked to the cytokines, is that right?
Yeah, yep.
And then the second is the virus, and the third one was the virus deforms. What's the third one?
Well, you're going to have the leaky gut. The leaky gut's going to be a strong stressor.
Now here's the thing, though. Don't we need to attack each one of those separately then? Because if we can get the receptors to work and we have adequate thyroid hormone, everything's going to work.
Exactly. You have to periodize things. Blood sugar, diet, lifestyle first. Adrenal, hormones, thyroid, gut, virus, infections, detoxification last. That's got to be the way you do it. If not, you get die-off reactions and all kinds of other issues. So you got to periodize it.
Well, now how do you deal with the autoimmune, though?
Autoimmune, you're doing all the things to calm the immune system. Vitamin D, stabilizing blood sugar, sleep, staying away from things that cause you cancer, right? Carcinogens and such. And then once you do that, you're stabilizing the adrenals and the thyroid. Then you're getting rid of the infections. Because a lot of the infections and metals and toxins are in the hepatobiliary tract, that they're excreted, so that's all messed up.
So Hashimoto's is reversible?
Yeah, I have no antibodies anymore.
Okay.
The study selenium for 3 months, 200 micrograms. One study they dropped antibodies significantly. I had a patient 1,500 antibodies, 2 months. He got down to 500. It can fluctuate though, but that's why you keep track of it. You want to be scientific. Yeah.
Any other questions? Thank you very much. That
Thank you.
was great. Very appreciated.
Thanks.